Using our 3 steps, let's break this down. This question is asking for which situation regards the key problem as C-color after an ATV accident. So before looking at the options, you're suspecting head or neck or even back injury with any type of neuro deficit. So the solution we're looking for are indications or findings that indicate that the patient needs a C-collar, basically an immobilization device for the cervical spine here. So option number 1 is correct here. Head and face lacerations is evidence of a head injury. So we definitely want to protect the patient with a C-collar. Now option number 2 is incorrect. Spinal arthritis is not technically a head, neck, or back injury. So arthritis is just bone on bone, and it's a very gradual chronic condition here. Now option number 3 is correct. Confusion is technically a neurodeficit and after a head injury, so we want to be precautious. Option number 4 is incorrect. An eye irritation and burning is not head, neck, or back injury. And now option number 5, this was really tricky, so it's technically correct here. So guys, clothing smelling like marijuana may indicate that the patient was under the influence with decreased pain or injury sensation. So a lot of the times patients who are under the influence, they won't have sensation to pain, and they'll basically have an injury and cause themselves to ward off. And sometimes patients can even paralyze themselves by accident. So it's always safe than sorry. You want to put a C-collar right there. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now using our 3 steps, let's break this down. This question is asking for statements that demonstrate understanding for the key problem, basic safety with advanced dementia. So the thing you have to understand about dementia before looking at the options is confusion and safety. So a big risk for falls and a big risk for the patient getting into things that they shouldn't be. So solutions we're looking for are remarks by the caregiver that are true regarding safety for dementia patients. So option number 1 is correct here, guys. Clutter can be a huge fall risk for really any patient. Now option 2 is incorrect. The patients have limited cognition ability, so they may not be able to remember the meds they're taking. Now option 3 is correct, guys. Deadbolting the doors puts the patient less at risk for wandering and getting lost. So we lock the doors there. Now option number 4 is correct. Patient at risk for wandering and getting lost. So option 4 and 3 would both be correct in terms of keeping the patient safe. And lastly, option number 5 is technically incorrect. The patient should be supervised for risk for wandering and falls. 2 big safety risks. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now using our 3 steps, let's break this down. This question is asking for the priority data to report for the problem, a Glasgow Coma Scale or a GCS of 8. So guys, the biggest thing we have to think here is the level of consciousness. So anything less than 8 isn't great. Or the memory trick we also use is a GCS less than 8, then we intubate because the patient is getting worse and the respiratory failure is pretty much ensuing. So the solution we're looking for is info to give to the HCP now to prevent that patient from going into this respiratory arrest. So option number 1 is incorrect because the patient believes they're inside of a spaceship. Guys, that's altered mental status, and if the patient's talking, then that's okay, but it's not priority. So option number 2 is incorrect. A history of allergies is important, but technically not priority right now. Now option 3, this is the most correct because it's priority, guys. So a GCS of 10 an hour ago indicates that the level of consciousness is declining rapidly. So the next hour, the patient can be at a 6, and the next hour they'll be at a 4. Guys, the patient will probably be dying in about 5 hours. So option number 3 is the most correct. Now option 4 is also incorrect. Normal urinary output is not priority here. So option 3 is priority. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now using our 3 steps, let's break this down. This question is asking for the most appropriate instruction regarding the problem of a stroke with hard time with balance. So before looking at the options, I'm thinking here proper gait and assistive devices. So the solution we're looking for are directions to give the patient with safe walking. So option number 1 is our most correct here. So feet should be shoulder width apart, and the cane helps with balance and safety. Now option 2 is incorrect. Guys, continue with a stroke program. It doesn't really address the patient's need right now for balance and safety issues. Now option 3 and 4 are also incorrect. Limiting the arm and leg stretching doesn't really address the patient's need. And option 4, a wheelchair is not the first option for walking assistance. Technically a cane is, or another assisted device like a walker. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now using our 3 steps, let's break this down. This question is asking for the priority action of what to do now for the key problem, a patient with recent quadriplegia. So before even looking at the options here, guys, quadriplegic patient, the patient can't move their arms or legs, and usually it interferes with respiratory function as well. So no limb function and respiratory compromise. So the solution we're looking for are interventions to do now to prevent the worst possible outcome for this patient. So option number 1 and 2 are both incorrect here. Skin breakdown and turning is important, but technically not a priority. Guys, always think about the ABCs. Airway and breathing come first. And option 2, ADL provisions are important, but again, not priority. So option 3 is the most important here because continued oxygen saturation is priority. Guys, the patient's at risk for respiratory compromise with that diaphragm paralysis. So just think quadriplegic, the patient has muscle weakness from the neck down, limbs, and respiratory. And lastly, option number 4, therapeutic communication is important, but technically incorrect because it's not priority. So option 3 is our most important. So it's correct. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now using our 3 steps, let's break this down. This question is asking who to call back first for the problem. The nurse is reviewing phone messages for a number of patients. So the biggest thing that I'm thinking before looking at the options are ABCs as well as safety for loss of life and loss of limb. So the solution we're looking for are the patient with the worst potential outcome. So loss of life or limb again. So option number 1 is incorrect here. The patient taking an anti-migraine med with the expected signs and symptoms of a migraine. Guys, that's not important and it's not really priority in terms of loss or life or limb. So option number 2 is correct here. The patient has a signs and symptoms of infection and is also on prednisone, which is an immunosuppressive, leading to a myasthenia gravis crisis. So the biggest thing that you guys have to think is prednisone ends in zone, so just think S for zone ending. Drugs are S for steroids, which slows the immune system. Now option 3 and 4 are also incorrect here. So the patient taking anti-Parkinson's meds has an expected side effect of the med, but it's not priority. This is an expected side effect. And option number 4, the patient with Bell's palsy and jaw pain, it's expected because Bell's palsy, you get weakness on one side of the face. That is very similar to a stroke, but this weakness is pretty much expected for Bell's palsy. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for the appropriate documentation for the key problem, foggy fatigue and nausea post a seizure, or basically after a seizure. So, if you guys remember anything from seizure activity or studying seizures, this is completely normal after seizures. We need to allow the patient time to rest. So the solution we're looking for is the name of the phase that this patient will experience after a seizure. So guys, let the name help you. Post means after, like the post-game report or the post-conference here. So option number 3 is the most correct, guys. Post-stictal is after the seizure. So option number 1, aureole or an aura, is basically a sensory that gives you clues that there's going to be a seizure. The ictal phase in option 2 is the actual seizure phase. And option number 4, the prodromal phase, is before the aura, or basically before the trigger. That's how you know you're going to have a seizure. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for essential interventions for the key problem, recovering from a hemorrhagic stroke. So before looking at the options, you have to think, hemorrhagic stroke, we have a brain bleed. So we need minimal stimulation, and we do those neuro assessments very frequently. So the solution we're looking for are actions that are important to do to the patient right now with this brain bleed or this post-brain bleed. So option number 1 is incorrect. Heparin would actually increase the patient's risk for more bleeding, since heparin is an anticoagulant. And option 2 is also incorrect. The patient should eat a diet as tolerated. So option number 3 is the most correct here, guys. Minimal stimulation to prevent increased ICP. Now, obviously, you guys remember that you have to cluster your care with anyone with neurological impairments, especially a hemorrhagic stroke. Now, option number 4 is also incorrect. Technically, visitors are allowed, but we want to cluster them. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. Now, this question's asking for an appropriate response for the key problem, family history of Huntington's syndrome, and they're worried about pregnancy. So, we're immediately thinking with Huntington, a neuromuscular or genetical disease. So, the solution we're looking for is the best reply to the patient's concerns here. So, option 1, 2, and 3 are incorrect here. So option 1, there's nothing in the question that states the parent has Huntington's. And option number 2, no indication in the question of the parent's race, or basically the patient's race as well. So only one parent needs to have disease to pass it on to the child. Now option number 3 is also incorrect. There's not enough info if the patient is at risk for a baby with Huntington's. So technically speaking, by rule of elimination, option number 4, a genetic counselor to assess the patient's risk, is the most correct here. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now using our 3 steps, let's break this down. This question is asking for discharge teaching to provide for the key problem, left-sided Bell's palsy. So before looking at the options, we're thinking about left-sided Bell's palsy. What are 2 or 3 things we know about it? Well, left-sided facial paralysis, it mimics a stroke. So we have left side facial nerve involvement here. So, solution we're looking for are instructions to provide with this patient. So option number 1, guys, the patient doesn't need help to move. They just have this facial weakness here. So that's incorrect. And option 2 and 3 are also incorrect. The patient doesn't need to cover both eyes when they're asleep. Guys, just the left side is infected or affected. And option 3 is also incorrect. Driving is not technically impaired. So option 4 is correct here. Soft foods are easier to chew and strengthen on that right side. So just tell patients to chew on that right side there. And option 5 is correct as well. The left side, so the left eye, is at risk for getting dry. So we need to moisturize it with eye drops. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now using our 3 steps, let's break this down. This question is asking for priority actions for the key problem, slurred speech, unilateral weakness, and face drooping, guys, 30 minutes ago. So the biggest thing you have to be thinking is the worst case scenario, which is a stroke, technically called a CPA, and we're thinking about getting that patient to a CAT scan and probably administering a clot buster because we have a clot inside the brain. Now, it could be Bell's palsy, which is just that nerve involvement with no clots, but we just don't know right now. So the solution we're looking for is interventions to do now to prevent the worst possible outcome, which is basically that stroke, the clot in the brain. So option number 1 is incorrect here. Speech treatment may be needed, but guys, nothing takes precedence over finding out if the patient has a stroke or that clot in the brain. So option number 2, assessment, guys, to check the neurofunction. That is good, so we have to choose it. We always choose assessment here. So assessing the patient's neurostatus, neurofunction is good. Now option 3, this was so close. Guys, a stat MRI is not what we do here. We actually need a stat CT, or basically a stat CAT scan. That verifies clots, bleeding, and vaso abnormalities here. Now option 4 is correct. TPA is needed ASAP to bust that clot. So this is technically called a clot buster. And option number 5 is incorrect here. The client may need info about stroke support groups, but guys, it doesn't do anything for the potential CPA right now. So we can't really prioritize that. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for manifestations to report for the key problem, the patient in the PACU recovering from a carotid endarterectomy. So, endarterectomy means that they're cleaning up the carotid artery, taking out plaque, and things like this. So, we're thinking about blood flow to the brain here. So, even if you didn't know what an endarterectomy was, if you think about the carotid, any type of procedure right here, we're thinking blood flow to the brain. So, solution we're looking for are findings that indicate the worst possible outcome. Basically, who dies first. So, option number 1 is incorrect here. Trouble remembering the nurse and repeating themselves. Guys, that's probably amnesia, and the patient really doesn't die first there. Now, option 2 was pretty close, but it's still incorrect. Drowsiness and slurred speech are technically expected after anesthesia, so when a patient's recovering from surgery. And option 3, nausea, vomiting, and hoarseness, as well as neck pain in the post-anesthesia area. This is technically expected here. So option number 4 is the most correct. A right arm that's lagging when they're lifting. This is technically considered one-sided weakness. So, one-sided weakness, we have to think stroke. And technically speaking, if you're doing any type of plaque removal surgery right here on the carotid, something can break off and clog something in the brain, which would lead to a clot in the brain. So, we have to think option number 4 is the most correct. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. So this question is asking for the priority action of what to do next for the key problem, violent vomiting after a procedure to reduce this intracranial pressure. So anytime I hear violent vomiting or even projectile vomiting and anything having to do with the head, that in terms of like trauma or any type of surgical procedure, guys, you have to automatically think increased intracranial pressure, basically more swelling and more bleeding. So the solution we're looking for is actions to do right now to prevent this worst possible outcome. So option number 1 is incorrect. Giving ondansetron, or basically an anti-nausea medication, doesn't do anything to save the patient right now. Now option number 2 is the most correct here. Contacting the healthcare provider, or basically the physician, for treatment. Guys, ICP or increased ICP, that intracranial pressure on the brain, it equals death. So immediately notify the physician or even the surgeon. Now option 3 and 4 are incorrect. Noting vomiting as a characteristic doesn't do anything to save the patient. And option number 4, positioning on the left lateral, Trendelenburg position, doesn't do anything to save the patient right now. Again, Trendelenburg, the patient's vomiting, it would cause an aspiration risk and the patient would choke. So option number 4 is incorrect. Okay, that wraps it up. For more details, now using our 3 steps, let's break this down. This question is asking for interventions to perform for the problem, a grand mal seizure here. So guys, anyone with seizures, we're just thinking airway, breathing, circulation. The big thing is airway here. And putting the patient on their side and removing anything that can fall on the patient. So keeping the patient safe. So solutions we're looking for are actions to do for this patient right now. So option number 1 is correct. The recovery position to prevent choking on their own saliva. So basically putting the patient on their side is recovery position. Now option 2 is incorrect. And guys, I know the movies do this all the time, so technically incorrect. Guys, we never place anything inside the patient's mouth because they have a risk for choking on it. So don't do that. Now option 3 and 4 are correct. Suctioning to keep the airway clear and preventing that aspiration or choking on their own saliva. And option number 4 is correct. Getting help during a seizure is technically patient safety, so as long as you don't leave the patient. So hitting a call light is technically okay. And option 5 is incorrect here. We never restrain the patient, guys. It's not necessary. So Just make sure that the area around the patient is clear so the patient doesn't have injury. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question is asking for who to assess first for the key problem you're caring for patients. Just basically a number of patients here. So the biggest thing when given these type of questions, guys, we're thinking about who dies first. So airway, breathing, circulation, the ABCs, and anyone who is at risk for safety issues. So the solution we're looking for is loss of life or loss of a limb. Basically, who dies first. So option number 1 is correct. The patient that has fallen or fell, guys, they have a headache and projectile vomiting. If you guys didn't know, projectile vomiting is a huge sign and symptom of increased intracranial pressure. So again, projectile vomiting or even battle signs like raccoon eyes or even drainage from the ear, it could be CSF, basically a cracked cranium. But projectile vomiting is a big sign here. So option number 1 is correct. Now option 2, 3, and 4 are all incorrect, but option 2 was a really good distractor. So headache, nausea, and vomiting with the glioblastoma. Guys, that is slowly increasing ICP, but it doesn't take priority over option number 1, that projectile vomiting. Now option number 2, garbled words and lack of coordination with this type of toxicity to the drug is priority, but again, option number 1 is the most priority. That one's gonna die the fastest. So, option number 1. And lastly, guys, option number 4 is incorrect because abdominal cramping and pain with urination may occur with a lower lumbar injury. So, guys, we'll just give that patient a catheter and monitor. So, option number 1 is our most important patient. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. Now, this question is asking for the most relevant nursing diagnosis for the key problem, homonymous hemianopsia. Now, if you guys didn't know what this was, just break down the word real quick and let the name help you here. So, opsia has to do with the eyes, and hemi has to do with half of the body. So, just think, we're thinking about visual deficits, and the patient is only seeing out of one side of each eye. So, the biggest solution we're looking for is a nursing diagnosis related to visual deficits here. So, option number 1 is incorrect, guys. Aspiration is more of food going down the wrong tube into the lungs, more of a choking thing, not a visual thing. Now, option number 2, impaired skin integrity, again, guys, has nothing to do with vision. So option 3 is the correct option. Risk of self-neglect. If the patient can't fully see, they're probably going to neglect a side of the body if they can't see it. And option number 4 is incorrect. Sleep deprivation is not really related to one-sided vision here. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question is asking for appropriate instructions regarding the key problem of dementia. So the memory trick we use is decreased cognitive ability with dementia, as well as changes in behavior. So the solutions we're looking for is teaching that should be shared with caregivers of patients with this disease. So option number 1 is correct here. Change the topic to something less threatening or irritating if the patient's upset. So guys, and with anyone with cognitive disabilities, we always redirect the patient, especially any type of psych patient. So the same thing applies here. Now option 2 is incorrect here. Close-ended questions that are simple for the patient is pretty much recommended. And option 3 is also incorrect. Allow the patient to help with their ADLs as it's appropriate. Now option number 4 is correct here. We keep choices simple and easy for the patient to follow. And lastly, option number 4 is incorrect. Speak to the patient at the adult level. So the biggest thing is we don't want this dementia patient to be irritated. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for the correct nursing action for the key problem. You gave the patient hydralazine for a blood pressure of about 180, and now the blood pressure is around 167/96. So, the biggest thing I'm thinking before looking at the options are hydralazine is a vasodilator to decrease the blood pressure. So, the solution we're looking for are interventions to do for this patient. So guys, just think here. The blood pressure was crazy high. We were almost in hypertension crisis here. And now the blood pressure is systematically getting lower and lower. It's still high, but it's just getting lower. And the other thing is the question never really gave you a timeline here. So keep that into consideration. So option number 1 is incorrect. There's no indication the order is incorrect, so we have to throw that out. Now option 2 is also incorrect. The systolic blood pressure doesn't meet the parameters of the order to administer. And option 3 is the most correct. This is really tricky. So guys, we continue to monitor the patient's vital signs because technically speaking, the blood pressure is still high. We're just monitoring it decrease. Now option number 4 is also incorrect here. There's no indication to reposition the patient. That would actually increase the blood pressure here. So option 3 is the most correct. Just continue to monitor that blood pressure. Okay, that wraps it up. For more details, now using our 3 steps, let's break this down. This question is asking for discharge instructions to provide a patient with the key problem of a concussion. So the signs and symptoms, guys, of ICP is what we're monitoring for. And no neuro impairment things. So basically like no alcohol or things that are going to make you low and slow, like maybe an opioid. So the solution we're looking for are teaching that is appropriate for this patient here. So option number 1 is